HIV, the human immunodeficiency virus, is a virus that lives in human blood, sexual fluids, and breast milk. It weakens your immune system, and if left untreated, it can lead to AIDS, acquired immunodeficiency syndrome. Every day, over 14,000 people become infected with HIV/AIDS. Unlike other viruses, you can't get rid of it completely. Once you have it, you will always have it. HIV is typically a sexually transmitted infection. Other ways you can become infected with HIV are getting a blood transfusion, sharing needles during pregnancy, and through breast milk. HIV attacks the body's immune system. It attacks T cells, CD4, T cells which help the immune system fight off infections. HIV patients get infectious or infection-related cancers easier due to the reduction of these T cells. CD4 cells are a kind of T cell which rapidly declines in patients with HIV. A normal CD4 count is usually above 1,000. AIDS patients have 200 or lower in their blood. Scientists acknowledge that the source of HIV infection in humans comes from a type of chimpanzee in Central Africa. Studies show that HIV could have been exchanged from apes to humans in the 1800s. The first documented AIDS case was in 1981, and since then around 35 million people have died from having this disease. The virus that causes AIDS, HIV, was discovered in 1983. Credit is mainly given to two different doctors, Dr. Luc Montagnier of the Pasteur Institute in Paris and Dr. Anthony Gallo of the National Cancer Institute in Washington. HIV was discovered as these scientists from all around the world were racing to figure out the cause of AIDS. Tools used to diagnose HIV/AIDS are the ELISA test, which is the typical blood test that they first used to test for HIV. And then if that comes out positive, then doctors will use the Western blot, which is used to confirm the ELISA test. There are also saliva tests, viral load tests, and there's actually one home test, which is called the Home Access Express test. HIV is an infection that progresses in 3 stages: acute HIV infection, chronic HIV infection, and AIDS. As chronic HIV advances, HIV levels increase. The number of CD4 cells also decreases. Declining CD4 cell levels indicate increasing damage to the immune system. Stage 1. Acute primary infection symptoms. It can feel like the flu, such as high temperature, body rash, sore throat, swollen glands, headache, upset stomach, joint pains, and muscle spasms. Stage 2, the asymptomatic stage, is actually a person can begin to feel better even though the HIV is still actively infecting new cells. Stage 3, symptomatic HIV infection symptoms include weight loss, chronic diarrhea, night sweats, fever, persistent cough, mouth and skin problems, regular infections, and serious illness or diseases. At this stage, the person infected is now considered to have AIDS. Treatment for HIV/AIDS. HIV is treated using a combination of medicines to fight HIV infection. This is called antiretroviral therapy. And the ultimate prognosis for HIV/AIDS is the expected outcome is for AIDS is death. However, HIV takes longer to progress, but eventually becomes full-blown AIDS. Some treatment for HIV. Currently, there are no licensed vaccines for HIV or AIDS. Scientists are getting closer to discovering a vaccine. In 2009, a study showed that certain vaccine combination could prevent 32% of new infections. What does it mean to have HIV? Society used to assume that someone who has HIV also practiced homosexuality, since homosexuals were some of the first publicly known carriers of the virus. Now HIV is still seen as a dirty virus, but anyone who doesn't practice safe sex is vulnerable. Some interesting facts. Most people recover from the flu-like symptoms, stage 1, and then they don't experience more symptoms for years. 1 in 6 infected U.S. citizens don't even know they have HIV. HIV is the leading cause of death among women of reproductive AIDS, and HIV can even survive in dried blood at room temperature, which is pretty crazy. The broader significance of HIV, HIV/AIDS needs to be recognized as something that is socially acceptable to have. Just because a person has it doesn't mean they do drugs. They could have just had an unfortunate sexual encounter. Some of the trends of HIV/AIDS. Transmission is increasing in minority women/young adults. Effective treatment is increasing lifespan. The awareness of HIV/AIDS is increasing, and government is addressing the AIDS epidemic. And even though it's still getting worse in some areas. 33% decrease in new infections since 2001. 29% decrease in AIDS-related deaths in 2005. 52% decrease in new HIV infections in children, and an increase in access to antiviral therapy. So overall, the AIDS epidemic is getting better. It's slow, but as more people become informed, we can start working towards a cure. So last little quote, or last little fact, every 9.5 minutes a person is diagnosed with HIV. So thanks for watching. I hope you enjoyed. Here's the bibliography. Yeah, hope you became informed.